drug B for hypertension. You can easily do that and give a decision. But if you want to decide, oh, should I invest in hypertension versus vaccination, you need one single unit that serves that purpose. So the cost effectiveness analysis, again, from Levin Annemans, he said it's not common analysis used to decide between different treatments for the same condition, and measures cost per unit. What do we mean by cost per unit? This is extremely simplifying maybe a model that takes 2 years to put the model, then to publish it, then it is well approved and validated, then you put your medicine. But if you really simplify everything, the mathematical formula is cost A minus cost B of comparative drugs and effectiveness versus the effectiveness of the other. Then if you really simplify everything, incremental cost effectiveness ratio could be the cost of therapy A versus the cost of therapy B, 270 versus 190, and the difference and the effect difference. Then you divide cost per each different effect, so you get cost per each effect, which is 80 divided by 8, which is death. And then at the end, you should think of what it means. So on a plane of effect on the horizontal axis and cost on the vertical axis, maybe I explain here. If a product is offered better with better effect and low the price, you just take it. Don't challenge much because they are not negotiating well. But if a product is, usually the whole discussion happens around here. As soon as an owner of a product, a pharmaceutical company or a company promoting X-ray versus MR versus X-ray, they will always try to charge for better. So they will ask for more cost to your budget, given the effect. So discussion is going to be around here. At some point, for a claimed price for an effect, you will say, no, this is too expensive. We understand this is better, but to that price, we don't buy it. Then suddenly countries looking all past decisions develop a habit of accepting at a level, then it sets their threshold. I will have a few slides on the threshold. Post-utility analysis is bringing qualities, because when you live, you don't always live in the same condition. In a perfect health for 1 year without a disease, it assumes you are in one perfect health, but it could be a disease that it could be a gastrointestinal infection, where due to this infection you are living in a good quality. Suddenly your life is still 1 year, you don't die from it, but suddenly you feel like half dead. Then for a certain days, then you feel better. So then this is the disease quality when you compare drug A versus B. Maybe a drug, maybe letting them to get into this level for 1 week and getting better. Maybe there could be drug B, which says this patient should only feel not half the death, this much, but based on study. And then it should take maybe 2 weeks in that condition. So what is then the value of drug A versus drug B? So this is the notion of 1 perfect health, 0 death. And then this all patient reported outcomes. There are, when you go to ISPOR meetings, you will see a lot of publication around utility, quality of life, but these are all at some point feeding this big engine of health economics evaluation, and usually the discussions are around that, because those are the soft things that like reimbursement agencies tend to underestimate pharmaceutical companies wants to promote. So the discussions are going around these patient-reported outcomes. And this is another formula to calculate quality. It could be, so let's do it together maybe. So if a patient, but the answer is there already, huh? So it's just cheat sheet. So if a patient lives for 2 years, 20 years, with half the utility level, then what would be the quality? So let's assume they are using a medicine. What will be the quality gain for this patient? 10? Yeah. Correct? And but what happens when we compare that maybe to another medicine? Medicine says quality will be 6, 0.6, but the patient at the end will die at the same year. We cannot provide any longer life. But still, it has some value. And this is calculated with multiplying 0.6 and 20, and then altogether maybe your quality will be 12. Correct. Then another treatment could say